Welcome, all you future nurses. If you're ready to absolutely master the skill of taking a body temperature, you are in the perfect place. We're going to break down every single step, from prep all the way to documentation, so you can walk into your clinicals feeling totally confident.
So, let's start with a question. Before you even think about reaching for a thermometer, what's the absolute first thing you do? And if your mind immediately went to the equipment, let's just pause right there. The most critical steps actually happen before you touch anything, and that's exactly where we're going to start.
All right, here's our game plan for today. We're going to follow the exact flow you'd use on the floor. We'll kick things off with prep and safety, then dive into the 5 different ways to take a temperature, figure out what the results mean, know what to do when they're off, and finally, we'll nail the documentation.
First up, prep and safety. These are the non-negotiables, the checks you have to do before you even get close to the patient. Getting this right sets the stage for everything else.
I love this checklist because it really shows that this skill is so much more than just using a gadget. It starts with your own clinical judgment, right? You have to ask yourself, is my patient stable enough for me to delegate this? Then you become a detective. You're looking at their chart, checking for trends, maybe a high white blood cell count, and then comes the core of nursing, safety and respect. Hand hygiene, 2 patient identifiers, providing privacy. These are the real first steps.
Okay, so once all those crucial pre-procedure checks are done, now you can gather your gear. You're going to grab your thermometer, some probe covers, and lubricant if you're going the rectal route. Having everything ready just makes the whole process smoother for you and, more importantly, for your patient.
All right, we are prepped and ready to go. Now it's time to pick the right tool for the job. Let's explore the 5 main ways we take a temperature, and we'll break down the absolute must-know steps for each one.
The oral route is super common, but getting it right is all about technique. First, you have to ask, have you had anything hot or cold to eat or drink, or have you smoked in the last half hour? That's a big deal. Then, the placement is key. You want to slide that probe deep into the sublingual pocket, that little space right under the tongue next to the frenulum. That's the sweet spot. It's full of blood vessels, which gives you a much more accurate reading of their core temp.
Now for the axillary, or armpit method. The name of the game here is contact. You need that probe right in the center of a dry armpit, at the very top, and then you lower the arm to create a nice, tight seal. A really common mistake is letting a sleeve get in the way or not getting that good skin-on probe contact. That's why it's considered a bit less accurate, but it's a fantastic option when other routes just won't work.
Okay, the rectal route. It's invasive, so our top priorities are safety and comfort. Once you've got your patient positioned and the probe is lubricated, remember this critical detail. You're going to aim the probe toward the umbilicus, the belly button. And why do we do that? Because it follows the natural curve of the rectum. This simple step helps prevent injury. And please never, ever let go of that probe while it's in place.
When you're using a tympanic thermometer, getting the pinna, the outer ear, positioned correctly is absolutely non-negotiable. You see, the ear canal isn't a straight shot. For adults and kids over 3, you'll gently pull the ear up and back. For the little ones, under 3, it's down and back. This simple move straightens out the canal so the scanner gets a clear shot right at the eardrum.
This one looks easy, right? But it's so often done wrong. It's a 2-part move that's absolutely essential for accuracy. You start flat on the center of the forehead, press the button, and slide it all the way to the hairline. But don't let go yet. You then lift the thermometer, touch it down on that soft spot just behind the earlobe, and then you release the button. That second touch helps correct for any heat loss and gives you a much better final reading.
And here is where it all comes together. This table is basically your cheat sheet for clinical decision-making. It's perfect for your study notes. You can see at a glance, oh, right, I shouldn't use a rectal probe on a patient with a bleeding disorder. Or, the oral route isn't a great choice for a mouth breather. It's all about picking the right method for the right patient every single time.
Awesome. You've done this skill perfectly, and you have a number. But, getting that number is really only half the battle. Now we have to figure out what it's actually telling us about our patient. So this right here, this is our target zone.
For a healthy adult, we're typically looking for something between 36 and 38 degrees Celsius. Your first job is just to see if the reading you got falls within this range. But always remember, this is a guideline. Everyone has their own normal baseline, and it can change based on their age or even the time of day.
It's also so important to use the right words. A fever isn't just a high number. Think of it like someone has turned up the body's internal thermostat, usually because it's fighting off an infection. Hypothermia, on the other hand, is the opposite problem. The body is losing heat way faster than it can make it. They're two totally different physiological processes.
You can't look at a temperature in a vacuum. A single number is just one clue. So, is that 38.1 a brand new fever? Or has it been slowly climbing all shift? The real story's in the trend. You always have to compare your reading to what's normal for that patient to see if they're getting better or worse.
So what do you do when that number is outside the expected range? Well, your assessment isn't over. In fact, it's just kicked into high gear.
Your response has to be systematic. You never just chart the number and walk away. First, you assess for other signs. Are they shivering, sweating, confused? Then, you communicate. You gotta let the provider know what you found. Next, you intervene with the right measures. Maybe warm blankets for hypothermia or a prescribed med for a fever. And you always stay ready for what might happen next.
And here we are, at the final and arguably one of the most critical steps. You've assessed, measured, and interpreted. Now you have to document. Because you know the golden rule in healthcare. If it wasn't charted, it didn't happen. Your documentation has to be crystal clear. It's not just the number. It's the number, the unit of measurement, and, so important, the route you used. A rectal temp of 37.5 means something different than an axillary temp of 37.5. You also need to chart any other signs you saw, what you did about it, and how the patient responded. This creates a full, complete story for the whole team.
So, I'll leave you with this question to carry with you into your practice. Beyond just the number on the screen, what story is your patient's temperature telling you? Because at the end of the day, you're not just treating a number, you're caring for a whole person.
Hey, if this explainer helped you connect the dots on this skill, do me a favor and hit that like and subscribe button for more nursing videos just like this one. And listen, to really help you crush your exams, check out the links in the description below for our summarized NCLEX revision guides. Thanks so much for watching, and we'll see you in the next explainer.